Hi, my name is Alex Preissig. I'm a junior biomedical sciences major at Quinnipiac University, and I'm going to discuss a vaccine-preventable disease and its vaccine. This disease is HIB, Hib. It's an acronym that stands for Haemophilus influenza type B. It is an infection caused by a bacteria known as H. influenzae. There's a lovely diagram for you. This bacteria is a coccobacillus, which means that it's not exactly rod-shaped, nor is it spherical shaped. It's kind of in the middle. This bacteria is gram-negative, which is a description of its cell wall, and it's also an aerobic bacteria, which means it requires oxygen for it to thrive. The type B refers to it being one of 6 strains of HI. These strains are capsulated with polysaccharides. They're enclosed with complex sugars. There are strains A through F, and type B happens to be the one that's most dangerous. The influenza outbreak of 1918 was an epidemic in which many people were affected by the H1N1 virus, but at the time they didn't really know that. They thought the agent was Hib, because a lot of the patients were experiencing Hib in their bodies. Turns out this was not the case, as we found later. For those people, later meant 15 years after 1918, when they had the equipment to discover viruses, and they realized that the flu was obviously a viral infection, and Hib was merely causing the secondary infections that these people were experiencing. With regard to symptoms, there are 6 classic symptoms indicating Hib. The first is meningitis, inflammation of the meninges, which cover your brain. This inflammation of this tissue could lead to fever, increased temperature, neck stiffness or difficulty turning your head, headaches, and photophobia, which is increased light sensitivity. You could have epiglottitis, which is inflammation of the epiglottis, which will cover your trachea when you swallow to prevent you from choking. This inflammation leads to drooling, difficulty breathing, and dysphagia, also known as difficulty swallowing your food. Next, you could have pneumonia, a classic respiratory infection, but it is important to note that this is indistinguishable from other pneumonias, so testing to be done to see if you have Hib or just some other infection. Next, you could have cellulitis, which is a skin infection that will manifest itself on your head, your face, and your neck. You could have pericarditis, which is inflammation of the pericardium, which surrounds your heart. This could lead to respiratory distress and tachycardia, or abnormally increased heart rate. You could experience arthritis. You'll have the joint pain, joint swelling, and decreased mobility that comes with it. You could also experience occult bacteremia, which is bacteria in your bloodstream. The blood is usually a sterile environment, so the presence of bacteria is a problem. This could lead to lethargy and anorexia. The people who are primarily at risk for Hib are children under 5 years of age. Turns out in the pre-vaccine era, 1 in every 200 children were affected by Hib, and 2/3 of cases affected children under 18 months old, and this is devastating for mothers with newborns and whatnot. Adults are also at risk, particularly those who have experienced splenectomies, which removal of the spleens, sickle cell anemia, a blood disorder, leukemia, which is a blood cancer, and chemotherapy, which will suppress the patient's immune system. Thank God for the Hib vaccine. It's very useful. It comes in 4 doses. The first dose is given at 2 months of age, the second dose at 4 months of age, the third dose at 6 months of age, and the final dose comes about 12 to 15 months of age. It is a conjugate vaccine, which means that part of the bacteria is used as opposed to the entire organism being used. It is a very efficient vaccine, 95% efficiency. You're going to get immune from it, and it can be available independently or combined with the polio and Hep B vaccines. Some concerns that people may have is that the vaccine is not safe, which is kind of ridiculous, because even though side effects include fever and swelling, those are manageable and easy to take care of, while there are rarely any serious side effects and rarely any allergic reactions. Additionally, adults being unvaccinated is alright, because more likely than not, they already have immunity from exposure at some point, but as I said before, there are people who are at risk, so people who aren't vaccinated should definitely get vaccinated. If you have any more questions, I advise you to go to cdc.gov/HI disease for any more information you have.